Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is what you need to know about facet joint syndrome. Every level of the spine has two facet joints, all the way from the neck down to the sacrum. They're about the size of a thumbnail. You can see there's one on the left, right, and so on and so forth. They contain cartilage, just like other mobile joints like the hip or the knee. Collectively, they allow us an impressive range of motion of our spines, bending, twisting, flexing. But even though they're small, they can be a tremendous source of pain. Okay? Facet joint arthritis starts in the disc. Here's a disc space here that's starting to compress. This is normal. This is normal. So what can happen is you start to get degeneration in the front of the spine and compression, and it shifts stresses to the back part of the spine. And you see these facet joints here, they start to get arthritic due to all this abnormal motion. Why is facet arthritis more complicated than hip or knee arthritis? Well, we don't have an effective facet replacement like we do in the hip or the knee. Those are very successful operations, and we don't have that for the spine. There are two facet joints at every spinal level. Think about it. You have two knees, you have two hips, and you have over 40 facet joints. And even though they're small, they can produce significant pain, or none at all. So it is more complicated than those other joints. People develop facet syndrome or facet arthritis. Most commonly, it's from degenerative wear and tear, which is called osteoarthritis. It's also called DJD, degenerative joint disease. Another reason would be post-traumatic degeneration. For example, if you have a significant whiplash injury, that can damage your facet joints and go on to create post-traumatic arthritis. And there's a genetic component as well. There's a lot we don't understand. How is the problem diagnosed? Well, history and physical exam can help a lot. X-rays can be highly suggestive, but you keep in mind you can have really bad-looking X-rays with arthritis, and the person may have no pain. Okay. Interventional procedures, you can do this procedure, a medial branch block. Here's a facet joint. The innervation to the joint, meaning the sensation, comes from these little nerve endings here called the medial branches. Okay, so if you block those with some numbing medicine and the pain goes away in the person's back or neck, you can sit there and say, aha, that's the joint that's causing the problem. Okay, you can also do an injection right into the joint, a facet joint injection. That can help as well. What are the available treatments for facet arthritis? Medications would be over-the-counter anti-inflammatories, Tylenol. For short-term exacerbations, you can do opiates. Long-term, they're not really a good idea. Prescription pain creams can be very beneficial as well. Those help a lot. Physical therapy and chiropractic treatment, TENS units, and then spinal decompression therapy, which is what you see here, which is computerized intermittent traction, can also help relieve pain coming from the facet joints. Interventional treatments, I mentioned the medial branch block, but basically you're looking at the facet joint here from the side. This is a nerve root coming out from the spine. These medial branches that come off of it come up, and they also come down. So there's two different nerve supplies. So blocking these with the medial branch block is a great treatment. It can provide on average 3 months of relief. You can also inject right into the joint, as I mentioned, with steroid and numbing medicine. That can provide months of pain relief. And then a radiofrequency ablation is when you actually put a catheter in here and heat up and deaden these little nerve endings. And that can provide pain relief for 6 to 18 months. Here you see the facet intra-articular injection, and then the radiofrequency procedure where a catheter is put in and it deadens these nerve endings for a long time. A medial branch block in studies has been shown to be 85% effective for the treatment of facet joint arthritis pain, and the average pain relief is for 3 to 4 months. Radiofrequency ablation has an 80% excellent results, and with pain relief from 6 to 18 months, the average pain relief is 15 months with one. All in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with facet syndrome. The top pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at NewJerseyPainNetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.